Okay, so you can see how we're on a journey this morning, going from the institutions where the discovery is made, but not just the discovery, they play a big role in facilitating the early steps toward commercialization of the technology that's developed there. And then we're going to hear from the incubators in a minute, which is the first stage to taking that technology to commercialization, but these are the companies who are actually closest to the clinic in terms of bringing their lead applications through clinical trials and finding out how they actually work in patients. And patients are our next perspective that we want to bring to this meeting today. And we are thrilled to have the HealthTree Foundation, which is a global nonprofit organization working to save lives through the HealthTree Cure Hub, which unites patients and researchers to help people with blood cancer live better and longer and lead a search for the cure. And we have two patient advocates here who have been patients themselves, who have been treated in Philly, and so we welcome them up to the stage to tell their stories. Richard Armstrong from the HealthTree Foundation and Michael Riotto, who he will introduce.
Technology has completely transformed our daily lives. It's unlocking new possibilities and experiences we couldn't imagine just a few years ago. And yet, despite decades of research, we don't have a cure for most cancers, and technology hasn't been properly used to enable us to find those cures. I was a wife and mother of 6 small children when I was diagnosed with multiple myeloma in 2010. This blood cancer diagnosis was shocking. I needed to survive, and I didn't have the luxury of waiting for someone else to build the tools that I needed.
The data that Jenny needed to make informed decisions should have been right at our fingertips, but it wasn't. Healthcare is one of the only industries left in the world that acts like the internet doesn't exist. And after working in the tech startup world for the last 30 years, we needed to reimagine a system that would allow cancer patients to share their data, share their experiences with the doctors, with researchers to find cures faster. So in 2012, HealthTree was born. We focused first on the needs of patients like Jenny, patients who need information and tools to help them work with their doctors to make more informed decisions. And then we turned to doctors and researchers who also didn't have access to all the patient outcome data. Details about patients' illnesses are spread out, data sitting in multiple databases across many organizations. In fact, most of the data is sitting in patients' heads. Doctors, researchers, and drug companies all have regulations that restrict what information they have access to.
We realized that patients are the only ones with the freedom to share their own medical details. We believed if more patients knew this and could do something about it, they would want to help. And we were uniquely positioned to take on this challenge.
We assembled a talented team of software developers to build completely new technology that links patients, their medical information, and researchers together. HealthTree Cure Hub offers patients the data and the tools they need to make life-saving decisions in partnership with their doctors. It's like the dashboard on your car, but it's for your health. HealthTree Research Hub is a living, interactive platform that continually and securely provides confidential data from thousands of patients to researchers seeking to answer key questions about cancer.
Today, 14,000 myeloma patients share their information with HealthTree. That large data set allows researchers to learn more about myeloma faster.
This life-saving platform should exist for all cancers and all diseases. And that's why we're expanding it to all blood cancers and, in the near future, solid tumors.
We are determined to find a cure, and this is only the beginning. Join us in changing the way cancer is cured by becoming a Cure contributor. Join HealthTree today.
So great, glorious morning, everyone. My name is Richard Armstrong, and I'm a local guy. I'm a West Philly kid, and born, raised here. And I'm a patient, a coach, and a health advocate. I'm currently working with HealthTree along with some other organizations. But I am a patient at University of Pennsylvania. I'm still a patient. I have multiple myeloma, which is an incurable blood cancer, but it is very treatable. And so I'm so grateful for the opportunity to tell my story. And I want to just thank all of the researchers and everyone who's committed to, just finding cures for these different diseases. And so technology has been a very, very important thing for me. And I had a bunch of sort of notes. And as I sort of saw these earlier presentations, it dawned on me how just important technology is for me. And so technology saved my life. And so let me see if I can cue this up here. I don't know how to, see if I can get the video. In May of 2021, I was very ill. And I literally almost died. So I was in acute kidney failure. And there's this thing called light chains that measure myeloma. And so normal level is between 3 and 19. I was at over 43,000. And so I landed up in the hospital, University of Pennsylvania, and I was 3 days critical condition. It was touch and go. And literally I thought, I didn't know whether I was going to make it. And by the grace of just fantastic world-class treatment at University of Pennsylvania, they gave me a 5-drug induction to knock down this myeloma. And so within 6 months, as you can see, I'm in this remission level in the green. And so I have to say that the innovation in technology is so amazing. So it saved my life. And so there's this drug called Darzalex, which is a monoclonal antibody that didn't exist when I was probably in my 20s, maybe even in my 30s. And if not for that disease, they would have, if not for that drug, they would have probably thrown their hands up and said, well, you've got 2-3 days and it's over. But, for that technology, I've lived. And it's amazing. I've had a stem cell transplant. I've had something called plasmapheresis, which the technology behind that is amazing. And so I say that technology is just, it's been that thing that saved my life. But I will say going forward that technology through HealthTree has really made my life worth living. And so, if you're diagnosed with an incurable cancer, the first thing you kind of say is, okay, well, what's my life going to be? How long am I going to live and what's my life going to be? And so I thought, for the longest time as I was regaining my health that, my life was just going to be in my room. And, I was diagnosed at the height of the pandemic, which was really, really rough. And so came out of that and, I was just trying to figure out what am I going to do with my life? How am I going to just turn this thing around? And so I was very blessed that I came across HealthTree. And so, I saw Jenny and I saw some of the other things that was going on in HealthTree. And so I'm a big, advocate for Penn Medicine. They saved my life. And, it's amazing. If you looked at me, you would never know that I was that close to dying. And, I walk 5 to 7 miles a day. And, I give so much credit to Penn Medicine. And so I found HealthTree. And so for HealthTree, and it's amazing because, they have this thing called Cure Hub where, they take the data and, Paul talked about it, taking the data and trying to use that data to influence, treatments and cures. But the other part of HealthTree and the part that really, really brings this home for me is that, they use technology in another way, a very simple way, and that it connects patients. And so, I'm a coach now, but when I started out, I had no idea how I was going to live. And then I came across coaches, people through HealthTree that, longtime patients that said, hey, you can do this. And this is how you're doing this. And I remember, my first coaching said, oh, my wife and I, we're going to Italy. And I'm thinking to myself, I'm like, is that allowed? Like, you can do that and live? Like, and so I say that it's really, really amazing because there's Michael, who I'm going to introduce very, very shortly, but these are our HealthTree coaches. These are HealthTree patients. And, using that technology for HealthTree, and I'm a big technology guy. I'm part of Penn Biobank. I've submitted that. I'm part of the Cure Hub. I'm a big believer that, we can use technology, but we have to use technology in a way not just to make life possible, but to make life worth living. And so, I like the humanity part of technology, and that's what HealthTree does really well, is the humanity part of technology and helping, people like me to find fulfillment, to find, purpose in life. And so I'm really, really grateful for that. And with that, I have to say, Michael Riotto, he has been just a really tremendous blessing to me, inspiration. You'll hear his story, and again, just another amazing story. Almost every myeloma patient has an amazing story, but Michael has an amazing story, and come on up, Mike, share your story. But I thank you so much for just sharing my story. All of the researchers and the people that are facilitating these cures, I just thank you. I appreciate it so much. Thank you for giving me life. Thank you for making my life worth living. Thank you, Mike. I appreciate you, brother.
Thank you.
Yes.
All right, how do you work this thing? Unlike Richard, I am not technologically savvy, so I guess we'll have to figure this out. So press the button. All right, and I can see them down here. That's great. So good morning, everybody. Good morning, everybody. All right, just making sure you're awake. Hopefully you had enough coffee and all that good stuff. And do I only have 5 minutes left, Nancy? Is that it? I can tell my story? All right, so I am a Philly guy too, just like Rich. I live in Warwick Township, Bucks County. Been here since 1987. Blessed to be in the Philadelphia area because there's so much good here when it comes to healthcare. You've got Fox Chase, and you've got Temple, and you've got University of Pennsylvania. Again, I'm a huge fan of U of P. My doctor, and some of you probably know him, Ed Statmauer. Anybody know Ed Statmauer in the room? Yes, no? He's one of the best myeloma specialists in the world, and I love him. And he's right there in the middle. We were at a big gala not too long ago. And one simple fact, and we'll get into it a little bit, but every time I see him, and I see him every 6 months now instead of every 3, and I truly, how do we get the pictures back? There we go. Truly appreciate what he says. He reminds me every time I see him that it's his job to keep me alive and my job to live my life. It's very profound, and it's very impactful. I am married to my lovely wife, Monique, for the last 37 years. I have 2 wonderful grown adult children. One just happened to move back in with me. I'm sure some of you have had that happen too. She just moved back in just a few days ago. The other one's in Boston working for a startup, which many of you in this room are startups. So I'm really proud of my son. He's doing there. So it's all really cool. Next slide. My disease. So right now, if you look at me, I look pretty good, don't I? Yes? I look pretty good. I try to work out every day as much as I can. I try to swim, and I really suck at swimming, but that's what my doctor wants me to do. Myeloma, rare blood cancer. 30,000, 32,000 folks every single year are diagnosed. Eat your bones. It's a disease of the plasma cells, and those plasma cells eat your bones. So I have lesions, as they call them, from my head all the way through to my feet. I have fractured my neck. I have fractured my collarbone. I have broken my left elbow. I have broken so many ribs, I don't know if they're still there. And I've broken both feet multiple times, especially the left foot, which I just had surgery done on to make it better. So back to the beginning, I was diagnosed in July 2011, completely by accident. I happened to be at the Jersey Shore trying to keep up with my son, who was 13 at the time, body surfing, and I got tumbled in a wave, and I hit my neck on the beach. Didn't know it at the time, drove home shortly thereafter. I get home and the wife's looking at me, she says, "You don't look so good." And I'm like, "Yeah, my neck really hurts really bad." She says, "Maybe you should go to the hospital." So what is the typical man thing to do? Sleep on it, I'll go tomorrow maybe, So the next morning I woke up and damn, it hurt worse than the night before. So I call my doc, he sends me for an x-ray about noon. About 4 o'clock he calls me and he says, "You really did fracture your neck. You fractured your C4 and your C5. I'm like, "Okay." He says, "You want to go to the local emergency room? I already called them. They're going to fit you with a collar. You'll be good to go." So I get there really quick, drive myself, go to the local hospital, fit me with a collar. Of course, they do a CT scan and MRI, some blood work. And you get that weird feeling that something's wrong when you're kind of like just hanging around. So I'm there for like 2 hours. I text my wife. I said, "You might want to come because they don't really know what's going on." And they actually didn't. They came back and they truthfully said, which was a beautiful thing, they said, we don't know what's happening. We can't handle you here. We got to ship you off. So off to Penn I went as a trauma patient at 11:30 at night. Again, get to Penn, more CT scans, more blood work, bone marrow biopsy the next day, and they discovered that in the normal person, the plasma cells that are in your bone marrow are less than 10%. Mine were at 88%. I had full-blown myeloma at that point. So immediately we started what they call induction therapy. I had a 3-drug regimen, unlike that guy who has 5. Yeah, see, things have advanced many years later. 3-drug regimen, and had a tough time with doing what they call apheresis when they collected my stem cells to get ready for a stem cell transplant, which I had 2 days after Christmas in December of 2011. I managed to get through all of that, and then all of a sudden, one of those things that happens to people, I got sepsis, and I went into septic shock for 5 days. They really didn't think I was going to make it through. They actually talked about it in the middle of the night one night, and they said to my wife, you might want to call the family and have them say their goodbyes. And somewhere in the middle of that, and I don't remember it because I was totally out of it, I shouted out, no, I'm not going anywhere. And I'm still here today, which is amazing. Absolutely amazing. So all through all this stuff, I do blood work every 3 months to check and see if my myeloma is going to come back, because there is no cure. There's no cure for myeloma. In the last 12 years, there have been 13 new medicines, 13 new treatments. You know, some maybe thanks to somebody in this room, maybe, that's come on board. And I'm an infant when it comes to the treatment of myeloma. However, there still is no cure. So all through the years, I've been on a maintenance drug. I've had radiation. I've had multiple surgeries, a couple on my back to take care of my back, because there for a while in 2017, I couldn't walk anymore. The lesions had become so bad that I literally was crawling up and down the stairs on my hands and knees. And finally, I said, you know what? It's time to get this fixed. So we got it fixed. So it brings us to my life today. What do I do today? I'm a huge believer in survivorship and thriving. I'm a huge believer that just because I have cancer, it doesn't necessarily have to define me. I work every single day at trying to make life better. If you get an email from me, there's a tagline, and it simply says, live and love every day as if it's your last, because you never know when something's going to get thrown in your face. So I work at it. I'm a huge believer in fundraising for myeloma. I'm a huge believer in taking care of yourself and self-advocacy. I think it's so important that we focus on ourselves. Is that selfish sometime? Maybe. But you know what? I'm blessed to be a peer-to-peer educator with the HealthTree Foundation. Blessed to be a myeloma coach. At one point, I had 23 coachees, as we call them, or patients. Now I have 13, which is nice. I can manage that, right, Laura? So 13 is a little bit more manageable. And it's incredible when you're out there in the world and your doctors and your nurses tell you everything that you need to know, okay? But when you're on a particular maintenance drug and you take it every single morning like your doctor told you to take it, and it makes you groggy and it makes you sleepy, right? And then all of a sudden you meet someone else who has myeloma, who's on the same drug, and they say, Michael, what do you take it in the morning for? Are you crazy? You're supposed to take it at night. I'm like, my doc never told me that. That's where the coaching comes in, because I slept so much better taking the drug at night. It's absolutely amazing when you just shift. Having a coach or having somebody out there that you can talk with makes a huge difference. And that's one of the things that HealthTree does as a corporation. They're incredibly great at mixing people together. You can go on their website. There's about 212 coaches right now that are active. You can type in, this is where, you know, technology comes in. You can type in sex, age, location, type of myeloma, you name it, and they can mix it up. And you know, it's really funny, Rich. I said to Rich, I said, I gotta make sure I put my cell phone down because I'm gonna get a political call in the middle of the presentation. Guess what? Political calls coming right now. They come all day long. So can you tell there's an election coming up? God bless us all. I'm a huge believer in fundraising for myeloma and myeloma research. One of the things that HealthTree does tremendously. Last year, I did a huge campaign and I raised about $13,000 for them to go to research because, again, as I mentioned before, there's no cure. Before that, I did a lot of fundraising for the Leukemia and Lymphoma Society, okay? I currently am doing some fundraising this year for the International Myeloma Foundation. And you're wondering why I'm talking about all these different organizations. We want to skip to this guy here. And it's because it's wonderful that everybody in this room, right, can come up with new therapies and great things that can help patients like me. But there's one big issue, okay? How many in this room are familiar with CAR T therapy? All right, thank you very much. CAR T therapy, there's two approved FDA programs right now for myeloma. Wonderful, it's terrific. There's only 76 centers in the United States that are authorized to treat myeloma patients with CAR T. Getting access to that CAR T, if you live in Idaho or Minnesota, okay, guess what? You're 3 or 4 hours away from the closest center that can get you that. We need access. We need to be able to get there. Patients need to be able to get there. I'm a huge believer in legislative advocacy. I'm in Washington, D.C. all the time working with our congressmen and our senators to talk about how we can get access. It's phenomenal, all the work that you're doing in this room, truly phenomenal. But if a patient can't get it, what's the point? We need to make sure that our laws and our policies reflect the simple fact that they can get it. The next thing, right, we work on affordability. How do we make it affordable? Okay, it's so wonderful. You know, this wonderful gentleman there, Richard, has a shot of Darzalex. How often? Once a month. Sticker price right now is $34,000 and change. Okay, $34,000 and change. Your copay could be anywhere from $0 to $1,100. Is it sustainable if your copay is $1,100 for 12 months in a row? The answer is no. Again, legislative advocacy, changing our laws and policies at the federal level to make a difference. So I was just there last week. I'm proud to say I won the Advocacy Impact Award from the Patient Access Network, or the Pound Foundation. I love being there. I've spoke on 2 congressional panels this year. It's phenomenal what you can get across. And you're all saying, does it work? The answer is yes, it does. It's a very slow process. You know, our government moves like at a snail's pace, but it does work. And the answer there is a simple fact of coming up. The last 5 years, I worked on the Medicare Part D program, which goes into effect this January, you know, $2,000 cap, which is really good. So you're saying out there, if you're meeting with your congressman or senator, do they actually listen? And the answer is yes, they do. 94% of the time, 94%. If they're on the fence about a particular bill and they hear a patient's story and they hear how the cost or the access isn't there for them, they'll sign on to that bill. So it's really, really important. So that's why, again, everything that you're doing in this room is wonderful, it's terrific, but if a patient can't access it or afford it, it doesn't work. All right, so we want to go back to this guy. All right, you saw Tony a couple different times, and we're going to talk about him for a minute. So Tony happens to be my best friend. I met at an IMF conference many years ago. And this is where some things like AI can come in. I was lucky. I live outside of Philadelphia. I have multiple resources at my fingertips to treat my myeloma, right? I happened to get diagnosed by accident because I fractured my neck. But this dude, right, I've known him for about 6 years now, lives in North Carolina, right? Rural North Carolina. It took him almost 7 months to be diagnosed. Almost 7 months. How many times did he go to the hospital? How many times did he go somewhere, all right, and complain, hey, I have back pain. Hey, I don't feel good. Hey, this happened to me, you know? This is where AI could come in. What could happen, okay? Where's my AI folks in the audience? By the way, that was a great presentation, wasn't it? That was really awesome. What would happen, right, if his symptoms were able to be put into a system and they were spit out to say, you know what, doc, maybe you should look at this test too. Wouldn't that be an incredible use of technology? Simple, because myeloma mimics so many other diseases. But wouldn't it be great if, hey, I have back pain, I have high calcium, my protein level's high, but yet the primary doc or the ER doc didn't realize that, but yet there was some way, some system that they could put in, and they could simply say, run another calcium test, run a bone marrow biopsy. An early diagnosis makes all the difference in the world in the treatment for myeloma. So the 80% of the folks out there, okay, don't have that ability. They live in rural places, they live in where an area isn't available. But maybe. My primary doc sees about, I think he sees about 6,000 patients, give or take, right? I'm still his only myeloma patient, okay? I educate him, but if he had a system where he'd be able to learn more about it and be able to recommend things, it would make all the difference in the world. So back to the patients need a cure and Cure Hub. HealthTree's Cure Hub. I belong to it for many years now. They have every one of my records. Yes, it scares the crap out of me, the simple fact that my healthcare records are out there somewhere. But you know what? I look at the simple fact it's for the greater good. It's for the greater good. It allows, Dr. Ola from Florida to be able to say, hey, I've got a male patient, he's 51, he's got diabetes, and he's got this, and I want to know how many other patients in your database have that. And boom, they can get it out in less than a month, okay? And that can issue a treatment plan for somebody that he's got, because it worked for me and it worked for, say, 1,700 people that are in the database. It's a phenomenal tool to be able to use the Cure Hub at HealthTree. If you have lots of questions about it, Laura, where are you? Everyone say hi to Laura Gilman. So Laura's here from HealthTree too. We'll be here through lunch if you have any questions about anything about HealthTree or our Cure Hub or our treatment. But I want to go back just a little bit. You're here, and being here is a wonderful thing, because maybe, just maybe, somebody in this room, and I'm going to be so appreciative if you do, is going to work on a project that's going to have a cure for me. Thank you.